Hello, everyone. Can everyone hear me?
We can hear you.
All right, great. Well, welcome everyone to Sensus Healthcare's second Zoom meeting. Today we're going to talk about Skin Cancer Awareness Month and keeping up with the treatment during COVID, what doctors have done, throughout this unprecedented time, and what we're going to be doing moving forward. As an announcement, unfortunately, Dr. Turner is in emergency surgery and will not be able to join us today, but we do have Joe and Dr. Romine on the line. We're going to be talking a little bit about how treatment was handled throughout the closing of so many practices and the decline in skin cancer inquiries while everyone's focusing on COVID. Also, what we will be doing moving forward. Want to thank you all for being on the call. Also say that, we hope everyone is staying healthy, happy, and safe. And with that, I will turn things over to Joe. Joe?
Thanks, Bridget. And if you hear any background music is supplied by Parker, our great vocalist today. But I want to personally thank Dr. Romine for joining us today and hosting this Zoom meeting that we have. So I want to welcome Dr. Romine and also welcome everybody who's on board today. I want to begin, Dr. Romine, by talking to you in particular as we're under this pandemic. How are things going with you and your practice in the surrounding area?
It's been good. I live in an area, it's a neighborhood office, and we have a large population here of elderly patients who like to spend the winters here. We also serve all ages, and it's been a really interesting time, as I think all of us have experienced. I'm a dermatologist and Mohs surgeon. I've been practicing for 22 years, and this, obviously none of us have ever seen anything like this, but it's been kind of an interesting and amazing time. When this first hit, I started thinking about, my practice and what we were going to do, and just really grateful that I was able to keep my doors open, as were the patients we allowed to come here. And very importantly also, it was a great coming together of our critical team. We were able to keep our team intact, which I know a lot of businesses during this time have not been able to do, but that was very important for me. And as soon as this pandemic hit, we all met together in morning huddles. We made a strict commitment to each other as well as to our patients to practice physical distancing. And those who we allowed into our social circle, we were our team members and a few select patients who, had urgent needs just to keep them out of the emergency rooms and urgent care. And the patients were really unbelievably grateful, as were the team members. So we met every morning in a huddle. We went through our CDC questions. We took our temperatures. And once we passed all those, we were able to go into the office and practice. So, it's been very, very different, obviously, for all of us. We've practiced a lot of telederm, and I think that will go on in the future. Many of my colleague friends have expressed the same interest and, some concern as well that patients won't want to come back to our offices anymore now that we've offered that. We've actually even done some what we call curbside visits. Our office is a standing building and parking right outside the door. So for patients who had bleeding lesions or blistering rashes and things like that, we were able to see them and even do biopsies out there. We did very limited surgery, once again, rapidly progressive, squamous cells or bleeding lesions. And we would even suture lacerations. So many more people are out on their bikes, doing sports outside, getting injured, and just wanted to keep as many people as we possibly could out of the emergency rooms.
Well, First of all, let me thank you and your team for that tremendous effort and service to your community. I'm sure that the patients absolutely loved the opportunity to be treated and to have you guys available to them when they needed you the most. So you deserve a lot of credit for being open, going through the precautions, and making sure that your community was covered whenever they needed it. So thank you for doing that. I know that being a Mohs surgeon is a great profession. You guys have done tremendous work, and you in particular have done a great job in your community. How has this impacted the people that you had scheduled or needed the surgery to begin with? How has that impacted those folks?
Well, it was really interesting. Early on, we got guidance from our governor that basically shut down any unnecessary surgery at that point in time. And depending on which academy you were listening to, whether it would be the Mohs College or the AAD, there was a little bit of differing reports. So we really did restrict our surgeries quite a lot. I think the spirit of that was just to save, personal protective equipment, obviously. But because everyone was looking at the rules a little differently, we got very stringent about who we actually had come into our office just to protect that PPE for the front lines. So we stopped ordering our own PPE right away after this pandemic started, to allow people on the front lines to have it. And so our surgery was very, very limited. Of course, I shut down my aesthetics practice immediately. And really, I just focused on my radiation patients, and then the rest of the time that I've normally been doing my aesthetics, I was able to focus on, just managing through this crisis with my team. And most importantly, it gave me time to, really think about policies and procedures for the more important even ramp up when we're, allowed again to release some of those restrictions and be able to see more patients in our offices, which is coming up for us next week, actually.
Great. So SRT was a good help for you in the practice at this time?
Yes, actually, my personal practice, like I mentioned earlier, my 2 PAs and nurse practitioners saw a lot of telederm. They actually called each individual patient that was on their schedules and asked if they had any urgent or emergent needs, or if it was something that they could see over telehealth, like, acne and rashes and things like that. That was very appropriate. But my practice was really pretty much restricted to superficial radiation therapy. And honestly, it was a lifesaver for me, and it was a lifesaver for my SRT team, as well as my patients undergoing the treatment. It's been a really unique opportunity to have like a jump start with this smaller cohort of patients about how patients are going to accept our care now once the offices are reopened. We had the opportunity to see what sort of questions they were going to ask, what sort of fears they expressed, and really connect with our patients so much more on even a human level. We're all going through this roller coaster of emotions. Some days we're doing really good, and then the next day we're super fearful about the unknown. But it was really a wonderful time for us. I know it's a horrendous time in the history of mankind, and I don't want to minimize that at all, but I really found that this was a time for humans to really show that they can cooperate and have that can-do spirit. And it's amazing to me. I think once, all the physicians are opening their practices, they'll see just the gratefulness of patients who are coming in to be treated. And, we were able to share information with our patients. We kept them updated on, what the latest greatest was with COVID, how to protect themselves, and, the research going on with vaccinations and treatment protocols. And, you know, so many people were just hooked to their TVs and so fearful. And I really think that educating them in this way and say, turn the TV off, you know, do some deep breathing, get outside, do some exercising, and leave it up to us to educate you about the coronavirus. They felt very comfortable with that, and they just felt empowered that they could, you know, take on every day. So it was amazing.
You know, I've gotten to know you over the last few years, and I'm not surprised. And I know how passionate you are about your patients. I'm not surprised that you took the opportunity during this time to get even closer to your patients. I think it's a good lesson for everybody and a good model for everybody to understand. It's really a great time to get to know patients and everybody in the community on a personal level rather than a professional level, because they really need us now more than they ever did. And so I commend you and your staff for doing that. I think it's a real opportune time, but I also have to say I'm not surprised that you did that knowing you. So congratulations on making that happen. We're slowly moving into Skin Cancer Awareness Month, starting tomorrow, the month of May. What should we all be doing as a dermatology community to make that more apparent to the public out there, the awareness? It's going to be tougher than ever before trying to get some publicity in spite of everything that's going on with this pandemic. But how do we break through to customers and to patients to make sure that they're taking care of their skin?
Joe and Dr. Romine, if I may interject really quick, we actually have had Dr. Turner join us.
Oh, great.
It seems like she's been able to, so I would like to welcome her. Dr. Turner, welcome to the call. And just a quick housekeeping note, if anyone has any questions, please write them in the chat, which you'll find right on the bottom of the screen, and we'll be able to take questions at the end. But welcome, Dr. Turner.
Thank you.
Hello.
Hi, Dr. Turner. How are you?
Hi, good. Thank you.
Good. Welcome to the program.
Thank you.
I just asked a question of Dr. Romine. Maybe you can pitch in as well, but the question was, tomorrow is the first day of Skin Cancer Awareness Month. We've got a big task in front of us as a community to try to keep everybody focused on the sun and making sure we keep our skin intact. It's going to be very tough with all of the publicity surrounding COVID-19. And so we've got a big task ahead of us to try to keep that awareness in front of everybody's minds at the same time of all the other things. And I'm sure it's going to be doubly impactful because as we start opening up the country to more movement around the country, we're seeing where in California people are running to the beaches. We're seeing here in Florida where people are running to the beaches. It seems that people just want to get outside. They want to exercise. They want to cycle. They want to swim. They want to play tennis. And of course, they want to enjoy the beautiful weather out there. So maybe you can chime in and what can we do to be better at doing that as a dermatology community?
I think it's always about connecting with our patients via social media, especially now. You know, we're using a lot of constant contact. We're doing the social media and have been throughout this COVID crisis. We're using our website. We have our banner up that's talking about the things that are ever changing. But social media is a constant way that we can connect with our patients. And so, of course, with Skin Cancer Awareness Month, we're doing things, just neat things that we're using. The Skin Cancer Foundation, they have, for each day of the month, there's different factoids about just different skin cancer facts. And so we're publishing one every single day of the month of May. And we've just done things like we've printed out some of those facts and we've posted those around the office so that just as they walk through the office, and they are now walking through the office, they are now coming in for their full body skin cancer screening. So they're starting to come back in to the office for their full body skin cancer screenings. So we're finally starting to get to do biopsies. We're getting new patients back into the SRT pipeline. So that's kind of a relief because now we're cycling out some of those, the other ones that were through the COVID crisis, but now we're starting to get newer ones back in through the new biopsies that we're now able to do. So I think there's going to be a lot of new opportunities as we come into May, just to remind our patients about sunscreen and just you know, protective clothing, hats, you know, all of the things that we've always done, but just connect to them on a different kind of level through ways like what we're talking about, social media, etc.
Thank you for that. One of the things that we'd asked Dr. Romine, and I want to ask you, of course, Sensus Healthcare has superficial radiation technology. And so how is that working in your practice, especially during this time?
I think in light of the COVID crisis, it's interesting because I think it's brought even more patients to the practice. You know, with the fact that more patients are using technology like the internet, they're finding me and they like the idea of a non-surgical approach, you know, less risk of infection, less risk of having to perhaps go to a hospital, no cutting, you know, nothing like that. They have found me and they're able to do their own research and find me despite recommendations perhaps from their biopsying dermatologist. And so it's been really interesting, and I've met new patients through SRT. So it's really been fascinating. We've gotten new patients into the pipeline even through this COVID crisis.
That's great. One of the things that we found in talking to many of the dermatologists within our network is the fact that 70% of our dermatologists that have SRT are Mohs trained and Mohs surgeons. And most of those doctors put off the surgery for 4 to 6 weeks pending the outcomes of this. But every one of them seemed to utilize the SRT by bringing patients over because of the patient's concerns, because of the patient's age, some of the pre-existing conditions. So it seemed to be something that continued or helped the practice continue through this period because we really didn't see any volumes go down. Was that your experience as well?
Absolutely. The only procedure that I was able to do throughout this whole entire crisis was the actual Sensus radiation. So I was doing telemedicine, but you know, you can't do any procedures with telemedicine. So the only procedural things that I was able to sustain through the crisis, through the pandemic, was the Sensus radiation. So those were the patients that I was able to actually physically see in the practice. So that's what sustained us.
Yeah. I would imagine that in every community, there's going to be quite a backlog of patients who have been waiting to be scheduled for Mohs surgery. And during this time period, as Dr. Romine had pointed out, there's been a lot of contact via internet as well as yourself. The patients searching you out, they're looking for things. Patient will never forget that they've been diagnosed with cancer, whether it's skin cancer or any other cancer. To them, that C word is very, very troublesome. So they want to be healed, they want to be cured. And I think they're going to look for additional opportunities and ways to do it, especially if it's non-surgically during this time frame. Especially, I would think that would be an opportunity for our customers in that area.
Mm-hmm. Absolutely.
Let me just ask you, as we go into, and I'll revert to Dr. Romine for this question, and then you can answer Dr. Turner after that. As we're going into the Skin Cancer Awareness Month, is there something that we could be doing as a company for our customers like yourself in helping become more aware of SRT as an alternative? We found in the past that it has driven more patients to certain physicians who are both Mohs surgeons as well as having SRT. It seems like those patients want that choice. What else could we be doing to drive that patient flow? Dr.
Well,
Romine.
I just think that, you know, getting public service announcements out there, perhaps even from Sensus, you know, talking about Skin Cancer Awareness Month and just allowing them to even have an option, you know, just like the recent article that was published in Practical Dermatology. You know, it's important to become knowledgeable about the different options. I mean, I've been practicing Mohs for 22 years and SRT for 6 years. And in my own personal practice, I don't think it's decreased my Mohs practice at all. I do think that it has increased my oncology practice just in general, because just as you mentioned, patients speak with other family members, friends, and, you know, they see that they've had this treatment done and there's no scar, and, you know, they were able to go swimming and play racquetball throughout and not have any downtime with it, that, you know, they come and find me. And then in addition, you know, when I send those records back to their primary dermatologist, sometimes the dermatologists aren't even aware of how effective and efficient this treatment is. So I think just getting the word out, you know, publications like we just did, and, you know, maybe even public service announcements. I think that along with COVID, I mean, throughout my entire time during this pandemic, I would still talk to each and every one of my patients about sun protection, because, you know, they didn't go into their offices. They were outdoors lots more. I did see one of my SRT patients had a sunburn, and it gave me a great opportunity to, you know, chat with them about, you know, it's so important that you protect your skin on a daily basis, and, you know, wear your sunscreen, wear your sunglasses, wear your big wide brimmed hat. And I'm just a huge advocate of covering up. I mean, I've learned myself growing up in Arizona that it's very difficult to apply enough sunscreen that will protect you throughout the day. And the reapplication process is so important. So, I mean, this is inherent in my being. This is my mission statement, is partnering with patients for a lifetime of healthy, beautiful skin. So I do the aesthetics part as well, 50% of my practice. However, you really can't have beautiful skin until your skin is very healthy. So I mean, all my patients that are my Mohs patients are often become my aesthetics patients, and vice versa. I can't tell you how many skin cancers I've diagnosed just by doing the aesthetics part. So for me, it's a continuous spectrum. And for, you know, this upcoming month, we too are doing a lot of social media. So it's all about education. And I think that if we just continue to put it out in social media and speak with every single patient, I staff with my PAs and nurse practitioners all the time. And I always speak to them about sun protection, even regardless if it's just an acne patient or someone there for a rash. I will always speak about that, because I think that's one thing when they did that survey several years ago, that only 40% of dermatologists actually spoke about sun protection and skin cancer prevention. So I think that's something, you know, it starts with us dermatologists and physicians in general. We just need to make this part of our mantra for every single patient.
Very well said. Dr. Turner, anything to add to that?
I was going to suggest maybe one of the things that we've had to do from a COVID standpoint was to take out all of our brochures from our office, because it's too many times I can think of how you walk into a patient room where we've had brochures and patients are touching and then they put it back into the brochure holder. So although I love the concept of being able to educate our patients through brochures, now in this day and age, you know, it's taken, you know, this crisis to have to take all of these things out of the room. So maybe if Sensus could come out with some kind of a little short video clip to then educate patients. And I'm thinking that we may end up having to put like video monitors in our rooms so that while patients are waiting on me, then we'll be able to, you know, have little short video clips to educate, for example, you know, Sensus, SRT, did you know about this as an option for treatment? Or, you know, as Kristine was suggesting, you know, I have aesthetics in my practice. I might, you know, talk about other things like you know, Botox or cool sculpting. So we could put it on a loop. And now that we don't have patients sitting in our lobbies any longer, instead we would have a similar loop in each exam room. So that might be a way that you guys could help us to educate our patients. Instead of brochures, have virtual brochures, essentially.
That's an excellent idea, and we will take that into consideration. Perhaps we can talk about this later. I also want to commend both of you regarding skincare. You guys are prime examples of practicing what you preach. And I think that's the biggest part of anything that you can offer a patient or anybody else. So excellent marks on all of that. Just in closing, what are your thoughts on the future? You've got a lot of aesthetics in your business. How is that being impacted? How will it be impacted for the future? Because that's an important part of your business too.
I'll start. So I think, as Dr. Turner mentioned, her office is already open. She's in Texas, and I think you got the opening okay a couple weeks ago. And starting tomorrow, May 1st for us, we're going to use that as a day just to run through mock trials of patients, because the flow of our office was quite busy in the past. We have completely rearranged how that's going to look for patients, just to keep them physically distanced from each other. Like Dr. Turner mentioned, there's no congregating of patients. They'll be taken streamlined from front door to their room, and then once again back out. There won't be a check-in necessarily or a check-out process where there's a potential for a waiting in line scenario whatsoever. So our aesthetics patients are clamoring. I canceled 6 weeks of their appointments, so I vow to all of them, I have really loyal patients, that I would work late nights, early mornings, and Saturdays. It's just like in any crisis, that lipstick phenomenon, you know, people are not going to give up those things that make them feel better. And as we know, the aesthetic part of our practice is such that those patients, their spirits are uplifted. These people have been sitting in their homes and, you know, feeling super lonely. And in addition, I mean, I'll get text messages and emails from friends of mine that I inject, and just, you know, talking about how ugly they feel and, you know, how sad they are that they miss their appointments. So I think that, you know, all these people who still have their jobs and are working from home, they're not spending any money traveling or going to restaurants. So they still do have that disposable income. So honestly, I don't feel that it'll be impacting that part of my practice. But once again, it's our duty as physicians to make our patients feel comfortable when they come here. And my personal mission is to put the word out to every single one of my patients, whether they be my general derm patients, my oncology patients, or my aesthetic patients, that it's super important for all of us to wear these masks. I mean, I don't go anywhere in my office. Good job, Joe. I don't go anywhere in my office without having one of these on. And this is the way that we're going to go forward and be able to keep our practices open, keep our businesses open. And, you know, I always say wearing my mask protects you and your mask protects me. So, you know, it's a no option in our office. Most of my exams will be done with this on until I need to look around their mouth, or, you know, if I need to work around their mouth at all. And then I ask them, please, you know, let's not have a conversation when your mask is off, because it's shown that the virus is in just the little teeny tiny aerosol. So, you know, it's like giving a little public service announcement on a daily basis. And I've told all my superficial radiation therapy patients throughout, tell all your friends, tell all your family that this is the way we're going to be able to still continue to flatten that curve and not get another spike. I was super happy to hear this morning that Costco just made an announcement that they will not allow any customers into any of their stores without wearing a mask. So that's going to help us, you know, in our mission to keep everyone safe.
Well, to Costco's point, I was there yesterday and they wouldn't let me in unless I had my mask and my gloves on. And 2 people can't go in until 2 people come out. And we have to stand 6 feet apart. So kudos to Costco, and I think it's a good example for everybody. Dr. Turner, how about your practice with the aesthetic side? How do you think that's going to be impacted as we come out of this?
I was honestly a little bit concerned, just hearing about unemployment rates going up, et cetera. But I think I've been very pleasantly surprised as to see the comeback of all the patients. The Botox patients are coming in, the injectable patients are coming in, and everyone is coming in. They're following all the guidelines. Everyone's coming in wearing masks. They're following all the social distancing. They're following all the guidelines. And the staff is following all of the protocols that we've set in place in regards to the cleaning guidelines and everything that we've done thus far going through. You know, so I think everything is running smoothly, and I've been actually really pleasantly surprised at the comeback in terms of the aesthetic rebound. So I'm very relieved, and I think that the economy will come back as what we've been told here in Texas. So I'm feeling better. My patient volume is increasing. So I'm feeling better and better about that. It's not what it was prior to the closures, but I think it's going to get there.
My personal opinion, I think you're going to see an avalanche of patients just coming back to their doctors, to their dermatologists. They've been sitting in the wings for way too long, and they want to get back to the open spaces, and they all want to look good, because I know my wife in particular can't wait to get back to the beauty parlor. You know, whether it's for a manicure, for a pedicure, you know, it's just, I think it's going to be a bombshell of people just pouring out of their homes, can't wait to get to your offices. So I wish you all the best in all of those practices, and of course, wish you all the best with patients that are coming to you in search of a non-surgical opportunity for skin cancer treatment or even keloids. Is there any questions that you might have of us, or is there anybody in the audience that might have a question for our doctors today?
Hey Joe, we do have one question on the chat. It is SRT not recommended for the area near the lip because of the thin skin in that area?
I'll let the doctors talk to that.
I'll answer that. I have 2 patients currently undergoing superficial radiation therapy for the lips, and I think it's an amazing treatment for that area. The only caveat is of course, if it's a gentleman, it will permanently take the mustache hair away from that area. I still have gentlemen who say, I'm never going to have a mustache. I'm never going to have a beard. So please do it. It is an amazing option. I have had dozens of patients that I've treated with superficial radiation therapy in that location. And when I talk to my patients, you know, they really look to me for guidance to see, you know, if it was on me or my husband or a friend, what would I do? And that's really how I approach every single patient. And I really do think that me personally, if I had a skin cancer really anywhere on my body, except for my head, I would definitely choose superficial radiation therapy, because I've just seen firsthand on so many occasions. I've treated many of my staff members with SRT, unfortunately, but they like that option, and they've seen patients come back. All my SRT techs said they would definitely, even though they're very young, they would definitely do radiation over surgery. So that's sort of a testament for those of us who are in the trenches every single day performing this and seeing the outcomes and seeing the patients and how pleased they are with their treatments. And really, honestly, once a patient has one site, one lesion treated with superficial radiation therapy, they never ever want to have surgery again.
Well, to that point, just a couple of years ago, I was with a Mohs surgeon in Tennessee, and there was a beautiful young lady who had a basal cell on the top of her lip. He said, if I do surgery, I promise you, you will have a scar. She says, I don't want a scar. And they went with SRT and she had beautiful results. So I think it's a perfect treatment for the lips, around the eyes, and so on. Dr. Turner, your experiences?
I agree wholeheartedly. I love it around the eyes, the lips. You have to use, you know, the proper shield in the eye area, but it works beautifully. And there's no issue because keep in mind, you know, it's only going at 6 millimeter depth. So I think there was a question that came across about worrying about teeth and gums. No issues with teeth and gums. We're not talking about the, you know, traditional sense of radiation in the older type of radiation. We're talking about superficial radiotherapy, you know, so that's where you don't have to worry about that, you know, that type of radiation therapy. That's not what we're talking about here.
Great point. One of the other questions that has arisen is, what are we doing to make sure that we sterilize, cleanse all of the materials that we use during the procedure, the shielding, things like that?
My team has been so great about religiously wiping everything down with a cavi wipe. This is part of our protocol even before coronavirus, but every single part of that machine is wiped down between every single patient. I mean, I've witnessed it many times. The lead shields are all wiped down. We actually put a paper sheet over them before we put that on, even though we are sanitizing that shield and the thyroid shield, and everything that comes into contact with that patient is honestly sterile. The rooms are wiped down like crazy, door handles, every part of that machine, even the monitor is sterilized between each and every patient. We're in addition, obviously, wearing gloves and shields and masks and all that. And just referring to the patient with the lip, we do put a little lead shield between the lip and the gums. So there, like Dr. Turner said, there should be no fear on a patient's side that radiation is going any deeper to hit any of those structures. But I agree, the radiation does not penetrate that deeply. And it's been amazing for tear trough areas, for even the medial canthus, where, you know, if I did Mohs surgery, it would be deforming, and the best plastic surgery repair would not look the same as their original anatomy. So patients absolutely love it. The eye shields are super easy to put in and out, and everybody's been just super delighted with it. So it's really great for those patients who have cancers in aesthetically important areas. Obviously, if you go over the eyelashes, it's going to take them away permanently. It's not great for eyebrows. If you can do Mohs surgery over eyebrows, obviously that's preferable. But those areas that we spoke about, it's perfect for.
Right. The last question that I'll pose to you is something that has started ever since we started with SRT. And the question is, we see where a skin cancer may occur after treatment. How do you know that it's cured? Dr. Turner, you want to address that, and then Dr. Romine?
I get that question all the time, and
I don't think it'll ever go away.
No. Well, now we have the new ultrasound technology, so now it's a moot point. But I think, you know, the way I used to explain it on the older devices was basically the clinical trials that Sensus performed. Is basically they could not have gotten the FDA approvals that they did without having proven their clinical satisfaction to the FDA that they had the cure rates that they did without showing clinical satisfaction for cure. So I said, you know, basically you do so many treatments to get the range of radiation to show cure, and we go even higher than that. And so patients are satisfied with that. And I said, and plus we continue to watch you through constant checks and monitors forever after. And truly, we just never see recurrence in these patients. It's remarkable that we just do not see recurrence after SRT. But now with the ultrasound technology that we have, you actually prove to the patient that the tumor bulk continues to shrink down, shrink down, shrink down.
Awesome. Dr. Romine?
Yeah. So I agree with Dr. Turner, and, you know, I do explain this to patients a lot. And, you know, we do treat a margin of normal appearing skin around the tumor. So, you know, we can demonstrate, like she said in the studies, that that margin was the margin that was required to get that 95-ish % cure rate. And I agree, we just don't have recurrences. And, you know, when you talk to patients about, well, if you've got an infection and you take an antibiotic, when you're done with that course of antibiotics, how do you know that it's really gone? And it's really based on symptoms. So if their tumor was treated and their tumor is now gone, I mean, I'm sure you've seen this too, Dr. Turner, that, you know, it really just causes some of those larger squamous cell cancers to implode, and it just gets sort of big and nasty looking, and then suddenly, you know, that crust, that scab comes on and off, and normal, beautiful, normal appearing skin underneath. I see this frequently on lower extremities, and I've done probably 1,200 cases of superficial radiation therapy. So, you know, it's just a consistent reaction and effect, and patients see afterwards that their skin looks beautifully clear, and they're satisfied with that explanation.
Great. Well, with that being said, I can't thank you both enough for your time, for your comments, and most importantly for your example of how to run a practice, how to practice what you preach. And we're just so thrilled to have you as our customers, and thank you for sharing your time today with the other folks on the line. Very much appreciated, and we look forward to seeing you very, very soon. Thank you all.
Thank you, Joe.
Thank you.
Thank you.
Bye-bye.